Some years back, my siblings had a tooth problem that necessitated the removal. The memory of the ordeal is still fresh in my mind. He had to bear excruciating pain and undergo a lot of therapy after the surgery. Now, that was just one tooth. Spare a thought for a 7-year-old boy who had over 500 teeth extracted from his jaw. Ravindranath had been complaining of a swollen jaw and toothache to his parents. In July this year, he was admitted into Savita Dental College in the southern city of Chennai. According to P. Senthil Nathan, a professor of oral and maxillofacial surgery in Savita, an X-ray and CT scan was carried out which revealed a fleshy sac in the boy's mouth that contained lots of teeth. The tumor-like growth was found around the molar side of the boy's teeth and was responsible for the boy's inability to grow molar teeth in that area. It was decided that surgery was necessary to treat the rare condition, but the boy wouldn't agree. This was exactly what he did some 4 years back when he started complaining of tooth pain, and the parents took him to the dentist after noticing a small swelling in his jaw. He had refused to cooperate with medical procedures and the swelling was left undiagnosed. This time around, his parents would have none of it. It took them several hours to convince him to undergo the procedure. Finally, he was wheeled into the theater and placed in anesthesia. Doctors then drilled into his jaw from the top in order not to break his jawbone from the sides, so there will be no need for jaw reconstruction after the surgery. Once the sac was located, it was removed from the boy's mouth. It took the doctors 4 to 5 hours to empty the sac and confirm its content. The sac held hundreds of abnormally shaped teeth, totaling 526. The teeth were in different shapes and sizes that varied between 0.1 millimeters, which is 0.04 inches, to 15 millimeters, which is 0.6 inches. Dr. Prabita Ramani of Savita Dental College told reporters each piece had a crown, root, and even enamel coat, indicating it was a tooth. While Ravindranath was released 3 days after the surgery and expected to make a full recovery, he suffers from a condition called compound composite odontoma. Odontoma is usually benign and typically involves several abnormal teeth forming inside a mouth tumor. However, Ravindranath's case seems to be unique because of the number of teeth involved. Ravindranath now has a total of 21 teeth remaining. According to the New Indian Express, dentists expect that the only long-term side effect that the boy may require molar implants when he turns 16 or 17. Otherwise, he's as good as healthy and will not feel any more pain. The cause of odontoma is still obscure. However, some dentists and researchers believe that odontoma is hereditary or that they develop because of genetic mutations. It is also probable that the cause could be environmental factors like radiation and pollution. The case of Ravindranath has sparked some studies on the root cause of the condition. Dr. Raman confided in the Times of India they have taken up a study to see if radiation from mobile phone towers is a factor in such condition. Odontoma is the second most frequent type of odontogenic tumor worldwide after ameloblastoma, accounting for about 20% of all cases within this relatively uncommon tumor category, which shows large geographic variations in incidence. Odontoma is found to occur in both sexes, male and female. It's more frequent in people around 14 years old as tooth that has not emerged and is accompanied by a number of symptoms such as difficulty in swallowing, dysphagia, tooth delayed from erupting, lump in the gum, or even swollen gum, like in the case of Ravindranath. People who have odontoma do not necessarily feel pain, except on a few occasions of discomfort in swallowing and munching. They could go about their business and perform normal teeth operations like chewing, munching, and grinding. This is because odontoma can only be seen in X-ray and CT scan results. Despite posing little risk to the patient, it is expedient that odontoma be treated to prevent the formation of cysts. Despite the rarity of odontoma, there have been similar occurrences of the condition. In 2014, doctors in Mumbai removed 232 teeth from the mouth of a 17-year-old Ashik Gavai after a 7-hour operation. The teenager was left with only 28 set of teeth and has fully recovered from the surgery. Surgical removal is the only treatment for odontoma, but as Dr. Senthil Nathan pointed out, it is important to discover dental issues on time and seek treatment as early as possible. Recently, awareness about dental and oral health has improved, and people are now keen on taking better care of their teeth rather than before. However, this awareness is predominantly concentrated in big cities and towns. People in rural settlements are still careless about their dental health. This can only be attributed to a number of factors, including lack of education, poverty, and poor medical infrastructure. Early detection and treatment of the condition will aid in the perfect recovery of the patient. So, the next time you have a toothache and you are complaining, thank God that you are numbered among those with normal physiotherapy and that you don't have to live with such anomalies. What would you do if you woke up one morning and discovered that your mouth has a bunch of extra teeth? Let us know in the comment section.